I have the pleasure of having our first speaker on stage, Mr. Andrew Fleming. Mr. Andrew Fleming has been the Deputy High Commissioner for United Kingdom in India, and he's been with us in India since 2017. He joined the British Civil Services in 1986. Thank you very much, sir, for joining us.
Well, good afternoon, everybody. It's a real pleasure to be here. Usually I start off by the traditional greeting, Sabhaku Namaskaramu. Some of you speak Telugu, so you'll get me. As I say, it's a great pleasure to be here. I have the first slot after lunch, and I know what happens to me at that time, so I'll try and keep you lively. First of all, I'd obviously like to thank Apollo Telemedicine Networking Foundation for the great opportunity to share my perspectives and views at this conference. With initiatives like these, we can work collaboratively towards creating an ecosystem for embracing new technologies in healthcare and help people in receiving the best of health facilities. It's great to see this gathering of industry leaders, government authorities, academics, leading healthcare and technology professionals today who are pioneering these changes in the healthcare segment of India. On behalf of the United Kingdom government, I would be delighted to work with all of you towards building the finest of healthcare amenities and systems for the people of India. In the words of your Honourable Prime Minister, Narendra Modi, UK and India are an unbeatable combination. Our countries are twin pillars of Commonwealth and have a unique blend of diversity and commonality between our cultures and traditions. The bilateral partnership between the two nations is built on shared values of democracy and deep beliefs in giving opportunities to people for expressing themselves. We encourage innovation collectively. We encourage creativity, and we remain committed to tackle global challenges like improving accessibility to public health by working closely and empowering one another and learning from one another. And not to forget our extraordinary passion and love of cricket, which I was warned not to speak about, but still I couldn't resist. I hope you all watched the recent heroics of the England cricket team in the Ashes tournament, which didn't go our way, unlike the World Cup. These mutual interests create a strong, healthy and evergreen bond of friendship between our nations. The UK-India relationship is a very special one that connects the ideas and people of the two countries with a living bridge which will be growing and prospering in all times to come. In the area of healthcare, it has been transformed heavily with the application of technology and new innovations, as Sir has said in the introduction. The concepts of artificial intelligence have transformative power to improve the accuracy, delivery, and impact of health services to the people. Artificial intelligence is able to revolutionize all verticals of the ecosystem, including hospital care, clinical research, drug development, patient monitoring, and is proving to be extremely helpful in reducing spending and improving patient outcomes. The leadership of healthcare industry is understanding the far-sighted impact of these new technologies and quoting a reference estimate from Accenture. The top AI applications may result in savings of up to $150 billion by 2026. Close to 20% of unmet clinical demand can be addressed with the help of artificial intelligence. From automated operations to precision surgery and preventive interventions, predictive diagnostics, the future of the healthcare industry will be reshaped by these technologies going forward. The three major impacts which artificial intelligence and technology will bring to the healthcare domain are as follows. Digital transformation. Artificial intelligence and tools like virtual reality can make operational procedures less expensive and so significantly reduce the turnaround timings. Secondly, helping healthcare systems in becoming more engaged, artificial intelligence can immensely help towards connecting patients and consumers with clinicians, health institutions, and medical service providers. And then in terms of diagnostics, developing new products and services that use artificial intelligence algorithms can provide diagnosis on health and advice to patients, as well as spotting trends and helping in more innovative treatments. I want to speak briefly about one British company that has come as a delegate to this conference, and that company is Isansis Life Care Limited, who are from Oxfordshire, not very far from our most famous and number one ranked university in the world in Oxford City. First of all, a lot of digital health has been about digitizing process. Isansis focus on digitizing patients using wireless technology. Lots of solutions use patches. I've seen them in T-Hub, I've seen them in plenty of other incubating centers, and I'm sure when I go to visit the new Apollo Incubation Center in Jubilee Hills, which I've promised to do over lunch, I will see them there too. But rather than just use patches for one solution, they built a system that is capable of transforming a whole hospital, completely automating the process of taking data observations and creating the most complete and accurate sets of physiological data, capturing health status and where they are going on the patient journey. And throughout this process, data, which, as I'm sure you're sick of hearing, is defined as a new oil generated, increases from the 30 to 40 points that might typically be captured by a patient under existing methods to something in the region of 25 million data points per person per day, which is a huge transformation and one that will ultimately transfer healthcare as we know it in an infinite number of ways. The UK also recognizes the emergence of this and other technological interventions in working towards steering the course of change in healthcare delivery so that we can improve healthcare for all. How can we not mention the National Health Service? When we were discussing transforming healthcare with IT, the National Health Service, which is now in its 71st year, is the world's largest health service with something in the region of 40,000 doctors of Indian origin currently serving within it, and many, many more who have experienced and had their trade and their initial training in the National Health Service, who are now back here in India. Indeed, many of my friends in that category based here in Hyderabad, some working at Apollo and some at many of the other hospitals across the city, which, by the way, as I'm sure some of you know, but some of you may not, Hyderabad has more 100-bed hospitals than any other city in India. Recently, NHS has launched plans to further engagement in the AI space and is creating a multi-million-pound AI lab to investigate the use of technology in the health sector. With an investment of £250 million, the initiative will help bring together the industry's best academics, specialists, and technology companies to work on some of the biggest challenges in the healthcare sector, including early cancer detection, new dementia treatments, and more personalised healthcare. This showcases the UK government's commitment towards embracing healthcare technologies that could transform patient experience and also improve the performance delivery parameters of public health services. What will be of more relevant interest to delegates here is the project that came out of an agreement made by our former Prime Minister, Theresa May, and Narendra Modi in April of last year to step up the health partnership between the UK and India, and specifically to focus on healthcare with artificial intelligence. The UK is investing £1 million in a multi-year programme that will bring some of the very best UK digital health AI companies to India to deploy their solutions in India's government hospitals and primary health centres. And we're specifically focusing on diagnostics and diagnostic AI that can help tackle some of the biggest disease groups in India today. But there are also many very specific benefits for India as it seeks to implement its Ayushman Bharat health reforms and move towards universal health coverage. According to the World Health Organization, India is short of almost 500,000 healthcare professionals, and at least one person I spoke to over lunch said that was a severe underestimate. Nevertheless, it's a number that will take many years to train. Digital health and AI has the potential to bridge this gap, not least because of the number of highly skilled developers and digital health specialists India produces. I'm also pleased to inform you about our forthcoming delegation of UK companies to India in December 2019, where we will be exploring areas of collaborations with key clinical leaders, healthcare providers, and healthcare institutions in the AI and digital health space. And I should also, I think, give a plug, because in 2020, July 2020, in fact, BMJ, with whom I'm sure you are all familiar, and who have a stall just next door, will be launching their first ever India event in Delhi, and very much would love all of you to join that. Focus is going to be on quality and safety of healthcare, and my newfound friend who's on that stall, Jessica Peacock, who was born not more than 20 miles from where I was born, would be delighted to speak to you more if you're interested to know more next door. Coverage contributing towards impacting people's lives is at the core of healthcare and its associated professionals. UK and India can work in close partnership and make huge differences towards enhancing the healthcare ecosystem for people, and I would like you all to contribute and work with us together in this joint initiative. UK's position as a world-leading healthcare hub and India's ambitious growth and reform plans to develop health amenities for its people are complementary partnership avenues for each other. We have a common vision to build an accessible, accurate, and publicly friendly healthcare system. And with your participation, I'm sure we will be successful in delivering the best healthcare outcomes for both our countries. My best wishes for this conference, and thank you very much.